Hello and welcome back to Alpha Nutrition. Today, we're going to talk about how HIV suppression works and how long it lasts. First of all, what is HIV suppression? Well, it refers to the treatment of HIV with antiretroviral therapy, or ART. This therapy works by stopping the virus from replicating in the body, which in turn reduces the amount of HIV in the blood to undetectable levels. But how does HIV suppression actually work? Well, when you take ART, the drugs target different stages of the HIV life cycle. Some drugs prevent the virus from entering healthy cells, while others stop the virus from replicating inside the cells. By using a combination of drugs, HIV replication can be significantly slowed down or even completely stopped. ART is a combination of medications that work to suppress HIV by interfering with the virus's ability to reproduce. There are several different classes of drugs used in ART, each with a different mechanism of action. These classes include nucleoside reverse transcriptase inhibitors, NRTIs, non-nucleoside reverse transcriptase inhibitors, NRTIs, protease inhibitors, PIs, fusion inhibitors, and integrase inhibitors. When a person is diagnosed with HIV, their healthcare provider will conduct tests to determine which medications will be most effective for their specific strain of the virus. Once a treatment regimen is established, it is essential that the person take their medication as prescribed to ensure the virus is suppressed. Now, let's talk about how long HIV suppression lasts. It's important to note that while HIV suppression can greatly improve a person's health and quality of life, it's not a cure for HIV. HIV can still be present in the body even when it's undetectable in the blood, and stopping ART can cause the virus to start replicating again. That being said, studies have shown that people who maintain viral suppression for several years have a lower risk of HIV-related complications and can even have a near normal life expectancy. In fact, the CDC states that people who are virally suppressed for at least 6 months and have no other sexually transmitted infections have a negligible risk of transmitting HIV to their partners. Moreover, when someone with HIV is on antiretroviral therapy and their viral load is undetectable, they can maintain their viral suppression for as long as they continue to take their medication as prescribed. However, it's important to note that even if someone has been virally suppressed for a long period of time, they still need to continue taking their medication to keep their viral load undetectable. If someone with HIV stops taking their medication, their viral load will begin to increase again. It's also possible for the virus to mutate and become resistant to certain medications, which can lead to a decrease in viral suppression. In addition to taking medication, there are other factors that can affect the duration of HIV suppression. For example, if someone with HIV has an underlying health condition or if they're taking other medications that interact with their HIV medication, this can affect their ability to maintain viral suppression. It's also important to note that HIV suppression doesn't mean that someone is cured of HIV. While antiretroviral therapy can significantly reduce the amount of virus in someone's blood and can even prevent the transmission of HIV to others, it doesn't eliminate the virus from the body entirely. Furthermore, after the first phase of treatment, the viral load of the patient is usually checked after 4 to 8 weeks. If the viral load has decreased, this is a good sign that the treatment is effective. The viral load will then be checked every 3 to 6 months. If a patient's viral load remains undetectable for more than 6 months, they can be considered to have achieved viral suppression. Achieving viral suppression is the goal of HIV treatment, as it greatly reduces the risk of transmission and helps to maintain the health of the patient. It's important to note that even when a patient has achieved viral suppression, they must continue to take their medication as prescribed in order to maintain suppression. Stopping treatment can lead to a rebound in viral load and potentially resistant strains of HIV. In addition to reducing the risk of transmission and improving overall health, achieving and maintaining viral suppression can also have psychological benefits for patients. It can provide a sense of control and stability in managing their HIV diagnosis and reduce the stigma associated with the virus. HIV suppression is a critical component of HIV treatment that can greatly improve the health and quality of life for individuals living with the virus. With the availability of highly effective antiretroviral therapy, achieving viral suppression is becoming increasingly possible for more people living with HIV. It's important for individuals living with HIV to work closely with their healthcare providers to develop a treatment plan that is tailored to their individual needs and circumstances. With proper adherence to medication and regular checkups, achieving and maintaining viral suppression is a realistic goal that can greatly improve overall health and reduce the risk of transmission. HIV suppression is an important part of HIV treatment that can greatly improve a person's health and quality of life. It works by stopping the virus from replicating in the body, but it's not a cure for HIV. With proper medication and care, many people with HIV can maintain viral suppression for decades and live a near normal life. Thank you for watching this video on how HIV suppression works and how long it lasts. If you found this video informative, please give it a thumbs up and don't forget to subscribe to our channel for more videos on health and wellness topics.